Hey guys, so this is probably a month and a half old. Dave and I did live on TikTok and I downloaded it and am uploading it to YouTube. Enjoy. So until about a little after midnight, I finally had to go to sleep.
I know. My wife was like, "What are you doing? Why are you out on the porch? It's time to go to bed." Hey, everybody, just saying hi in the chat. Good to see you all. Kimmy, Dunn, Leary, America, Mel, Christy. Hi, how are you? Carrie Ann, boss
Everyone
lady.
follow this man, by the way.
Yes. Just follow this man.
Follow him.
I don't know where he's leading you, but follow. Hey, Shauna, how are you? Carrie Lee, how are you?
I was saying earlier, imagine, because of this supposable Reddit rumor, right? That we could have been a rumor initially, we didn't know. But you bringing it out, I swear, people ran and stocked up, and you definitely helped some people.
Yeah. So, yeah, I want to touch on that because there's so many things there's so many things I've taken crap for the last week. And it's honestly, I think it's weighed on me a little bit more than I realized because I've been pretty down for the last week and a half. But the thing that came out on Reddit, you know, like everybody was like, you can't just say something on Reddit is true, you idiot. Like I don't know that. But like, I think what people have to understand is like, when I see something like that, I vet it to the best of my ability. I send it through the channel. I mean, I've been doing this long enough that I have like a lot of people that I'm connected to that I can leverage to figure out whether, at least in the context of everything that I know, whether it's worth reporting.
So you did that before you.
The reason that
is what you're saying.
Yeah, as soon as I saw it, I had spat it off. Yeah, I had spat it off. And when the FDA did not respond to it immediately, I just knew. Yeah. I just knew because it's very easy to say, no, that's not us. We wouldn't put out that information. No. And so given the context of like how we've seen Lilly move, I think Lilly has been gearing up because Lilly's known that this is coming. Yeah. And so that's why I put it out there. And I didn't put it out there as gospel. This is from Reddit, right? Yep. But it's been vetted by at least, you know, the people that I know. And it definitely was not popular, especially among a lot of people who are affiliates of because I realized, you know, rightfully so, that creates questions, and then they've got to answer.
People were freaking out. Yeah,
people were freaking out. But that's why I've always appreciated you, because I feel like you have always had a straight shooter, middle of like you've been able to maintain your objectivity, and being able to look at things in the bigger picture and just kind of say like, yeah, that could be happening. And like, and then people like you who are advocating can go, here, if this is true, here's what you do.
Have a plan.
Thank God people, you know, follow people like you, and that there are people like you that are creating that content who have the wherewithal to say that, you know, this very well could be true. And so if it is, this is what has to be done. So yeah, I put it out there. I took a lot of heat for it. And then yesterday it happened. And so, you know, I'm just thankful that there were people that listened.
Yep.
And took seriously what I was trying to articulate and actually made plans, you know. And because again, we have to live in reality. The reality is Lilly doesn't want these things to exist. And if they don't want these things to exist, they're going to leverage all their might to make sure that they don't.
Yeah.
Separate conversation about, you know, whether that's good or bad or whatever, but it is what it is. And so people need to be able to make decisions. And so, yeah, thank you for, you know, just maintaining your objectivity, because I know like you were one of the first people I texted when this thing came through, and you're one of the first people that I bounced this stuff off of, you know, because you are a logical thinker. And I appreciate that about you.
And even with Lilly, they get a lot of hate. Now, I don't hate Lilly. I have a love-hate relationship with Lilly. I'm sad about what's going on with Compound. but I also know these meds wouldn't exist without them. Like they wouldn't. We're getting you know what I mean. It's
yep.
So
on the same page. Yep. Yeah, I don't love the system, but you can't fault Lilly or Novo Nordisk for operating within that system. It is like even the whole list price thing. Why are we paying 10 times what they do in other countries? Well, if you actually look at the net price, which is actually how much Lilly takes home,
PBMs.
or to take home. Yeah, the net price that these pharmaceutical companies are bringing home are a lot closer to what they are in Australia or Canada.
Yep.
And it's the PBMs and it's the convoluted healthcare system that we have that I'm pretty convinced is designed to be complicated so that people don't understand it, so that people can't advocate for change, because there's so many hands in the pocket, in the pot, so to speak, of making money and profiting off of sick people in this country. And they don't want you to know whose hands are, and they just want to go, big pharma's the evil one, or, whatever. But the reality is insurance companies, the PBMs, are absolutely inflating the cost of medications and medical care in this country. And they're doing it for what? For being middlemen.
Yeah. What do you think will come out of this FTC PBM thing that's happening?
I don't know. I really don't know. I'm hopeful that it sounds like some of them might get broken up. I don't know how much that helps. I don't understand why they have to exist at all. I mean, really, my understanding is why they exist is ultimately because back when the Affordable Care Act was passed, it capped how profitable insurance companies could be. And so their answer to that was to basically create an industry that brokers, the pharmaceutical medication plans, and that just allowed them to set up as separate entities and become super profitable off of the prescription drug side. And then, oh, by the way, the major corporations that own these healthcare companies also are buying up the PBMs. So United Health Group owns United Healthcare and OptumRx and Change Healthcare. They own like everything. Everything is becoming so consolidated in this country. And you just have all these little pieces and they're all taking a cut and they all benefit off of sick people. And it just shouldn't be so. But the what am I trying to say? The system is what the system is. And we're all just trying to operate within it. And the only way that we can do that is to be able to plan. And the only way to plan is to be informed. And so that's why I appreciate people like you who are just objective. You're going to say how it is and let people make their decisions from there.
Yeah. Do you think there's anything as a collective we can do, whether it's a petition or, that could let the FDA know, look, we know there's a short, you know what I mean? Is there anything we can do?
Well, I think, I don't want to put a bullseye on myself, but I honestly think that I also don't want to give you a 30-minute response. Yeah. I think that the reason that this is off shortage, okay? The reason that I 100% think this is off shortage is not because it's actually not in shortage. I think we can all agree it's still in shortage. I think that what happened here is that when the Chevron case was passed down from the Supreme Court, which basically kneecapped federal agencies from interpreting vague law, right, and enforcing vague law, and basically said, no, the court system has to handle that stuff. You don't have the autonomy to just say this is how it is. I think when that passed down, Lilly goes, you know what, we're just going to make the calculation that we'll report the shortage based upon what we think, and then we'll see how the FDA responds to that. And I think the FDA responded to it saying, by basically internally saying, we don't want to get sued. We don't want to go to court over this because if we lose based upon the Chevron precedent, we lose a whole lot of power. And they did not want to fight that battle. Now, conversely, they still may have to fight that battle. But what will have to happen is you'll have to have a coalescence of 503B pharmacies, 503A pharmacies, maybe even telemedicine companies banding together and going, you know what, we collectively will will sue the FDA based upon the Chevron precedent, saying that they don't have the ability to, for the same reason Lilly could have sued them, just the flip side of the coin, right? So honestly think that if the FDA is going to be moved to any sort of action on this, I think it would have to be that they would get sued over this Chevron case and lose it. But a lot of things have to happen for that to happen, which is, I think, why they just sided on the side of Lilly, because the odds of that happening are a lot lower than it was probably a foregone conclusion that Lilly would have taken them to court. And they're already doing it with Tirzepatide or with retatrutide. Is
making enough noise going to do anything, do you think? Or
I don't know. I mean, I really think that it's sort of incumbent upon the 503 pharmacy, the compound pharmacies, to organize themselves and fight against it. And they have what's that?
I would love to see that.
Well, they're the only ones that I think have the power to do it.
Yeah.
And I think they're the ones, well, outside of just patients, because if patients could band together and get some sort of, I don't know. I don't understand enough about law. But to me, the path of least resistance would be the pharmacies banding together under whatever it is, the Alliance of Compound Pharmacies or whatever it's called, and them saying, we're going to go after Lilly based upon the Chevron, or we're going to go after the FDA based upon the Chevron precedent and see if we get anywhere with it. But that will be extremely expensive. But they would be able to make the case that they've been harmed by it, I think. So would patients, but I don't know if patients could. I just don't know enough legally. So there's going to have to be enough people who know enough legally about this kind of stuff to put all those pieces together, because it ain't me. I don't know enough about this stuff. But it in the courts. The short answer is the courts will need to resolve this. It's just who brings that suit and what and on what grounds,
Yep. I'm looking at the comments.
Yeah, it's crazy. And I think, like I was saying on my live last night, it's the wild, wild west, right? When people are like, what happens from here? Everything is speculation. People are like, you're speculating that Lilly, that the FDA will take it off shores. That's all speculation. Yeah, but it was pretty dang informed speculation, because you just watch the pattern of behavior of Eli Lilly, and you sort of watch what the FDA was doing. They were going along with it. They were like, hey, you can get all these doses. And the FDA just, okay, yeah. Except no, you can't. I mean, the 10 milligram dose is a unicorn right now for a lot of people. The 12.5 is a unicorn for a lot of people. And it's more than just, this is why I know it's more than just distributors, right? Which is what the FDA is telling us. The FDA just parroting what Eli Lilly has been saying, which is all factual. That the shortage is based upon Lilly's ability to supply wholesalers, not whether it's available at your pharmacy. But the thing that I struggle with is I have patients that come into my lives that comment on, or I should call them viewers, but patients of GLP-1s that come into my lives or come into my comments or DMs or email, and they're like, I'm using Lilly Direct, and Lilly Direct can't even tell me when they'll get my 10 milligram. Lilly Direct, there's no distributor. It's Lilly. So if Lilly Direct can't even tell you when you're getting your 10 milligrams, it's because they don't have it.
Yeah.
The reason that the shortage ended is simply because the FDA said it did.
Yeah, and isn't Amazon gets directly from Lilly too, I believe.
I believe so.
Yeah.
I believe so. Yeah. And DMP said, how can FDA just take their word for this? That's, again, it goes back to, it's just vaguely written. I don't even know if you can call it law, just guidance. This has always been a self-reporting tool. The reason is because there's never been a drug that has been so mass compounded ever before. This is unprecedented. And it's honestly, it's because there is unprecedented demand, and that demand hasn't gone away. And Lilly's capacity hasn't increased to the point that they'll be able to serve all the patients. It's just not. I mean, they've told us that on their earnings calls. They've said, like, and I had a phone call with the CEO of Eli Lilly, like, before they released the vials, and he said something, and I was like, but you and Novo Nordisk, with all your assets in the world, will still never be able to serve the market. It's going to take lots of other companies coming in, and other companies growing their manufacturing capacity at the rate that they are. Like, the stuff's going to be in shortage for a long, long time. And so, you know, the fact that it is Eli Lilly, again, they're operating within the system. The system says it's a self-reporting tool. And Lilly goes, all right, from our perspective, we can fill orders. And then sort of like, come at me. And then the FDA goes, well, if we come at you, you're going to come back at us with the Chevron case in the courts. We're going to lose it. And then the FDA is going to be kneecapped in 100 different ways to continue to operate autonomously without court interventions on stuff. Because that's the thing about these federal agencies, is they grow and they grow and they go and they're so big, and they're able to operate with a certain amount of autonomy, and they don't want to lose that. And the Chevron case 100% puts that back in play, that they could just sort of be kneecapped on any specific law. I mean, this is my understanding. The caveat is I'm no more a doctor than I am a lawyer, than I am a judge or anything like that. But
what do you know about, I know there's something with, because I know they're trying to get retatrutide kind of listed differently, but with tirzepatide, I know with one, like with the retatrutide, it would have, what does it mean? Like there's a 5-year thing with the FDA and then people can actually challenge it? What does that mean?
Sure. So people always think in terms of patents, right? But patent is not the only thing to consider when we talk about other generic versions being available. So there's two things to consider. First thing is a patent. A drug company comes up with a new molecule. They immediately file for a patent. The U.S. Patent Office grants them that patent. They have 20 years then from the grant of that patent before the patent expires. But when they bring a medication to market, they are only guaranteed 5 years of market exclusivity. It doesn't matter when the patent runs out. They only have 5 years of guaranteed exclusivity, meaning that within that time period that the drug comes to market, in that 5 years, somebody can challenge that 20-year patent, right? They can challenge that patent, and if they lose the challenge, then after that 5 years, even though the patent's not up, the challenge has been the patent has been challenged. The person who brought the challenge won. After that 5 years, then a bioavailable or biosimilar can come to market, or biosimilars for biologics. A generic can come to market.
So someone's got to challenge it in court, though.
Somebody's got to challenge the patent. And so, like, we're seeing this right now play out in the courts right now with semaglutide. Right. Because semaglutide's patent runs to like 2030 or 2032 or something like that. I can't remember. But the market exclusivity is over. That 5 years of guaranteed exclusivity. So, in other words, a drug company, when they develop a drug, they only are guaranteed 5 years where they won't have generics competing in the market. But in order for somebody to compete before the patent's up, they have to win a patent challenge. That's happening with semaglutide right now because semaglutide is very chemically similar to liraglutide. All they did was, I believe, don't quote me on this, but I believe all they did was switch one amino acid in the sequence and then added a fatty acid to it that allows the medication to be absorbed over a week instead of just hours, right? Because liraglutide's a daily injection. Semaglutide is a weekly injection. So they didn't change it very much. So their patent's being challenged in court basically because these companies that want to make generics are saying, you can't just do that and then repatent liraglutide. You didn't change it enough. So they could lose that. And as early as next year, we could potentially have a generic Ozempic. I can't remember, but they're either being challenged or they lost a challenge in China over something very similar. Now, with this whole process, the reason that Eli Lilly is suing the FDA right now over retatrutide is if your medication is classified as a biologic, you actually get 12 years of market exclusivity, and then nobody can make a generic formulation. They have to make a biosimilar. So there'll never be a generic version, so to speak. There will be a biosimilar, and this is what's going on with Humira right now, which is a anti-rheumatoid arthritis, some sort of autoimmune drug. Okay. So the thing is, to be qualified as a biologic, there has to be so many proteins in the chain of amino acids, and it has to do with how it's manufactured and all that. Eli Lilly essentially added an extra protein, but the FDA, I don't want to get into the weeds too much on this because I honestly don't. I'm not a chemist either, but they're basically Eli Lilly saying it's a biologic, and the FDA is going, no, it's not. And so Eli Lilly is going, okay, we're going to sue you over it and see if we can win in court, and then if they win that and they can get it classified as a biologic, the implications are it'll be on the market for 12 years before their patent could be challenged, won, and then a biosimilar brought. But then also it is illegal in the United States to compound biologics. So there would, regardless of any shortage, there would never be a compound version of retatrutide.
Even though there is going on. Not being funny.
Even though there is now, right? Right.
Like 503s it's weird what's happening with Retta right now. But wow. Okay, that was a very good, that was a good education. Now with, I don't know if you know this, but with semaglutide, for example, right? Let's say they challenge it and suddenly they can do a generic. Can it still be compounded? Like, what is compound once it's generic, or is that just over?
I think, like, okay, so let's take liraglutide, for example. If liraglutide was in shortage, which I don't know if it is or not, it might be. I mean by that I mean Saxenda, the brand name, Saxenda and Victoza. If those are in shortage, and Teva, which now makes the generic version of liraglutide, if those are all in shortage, then I would presumably the compounding could happen. So I would imagine that'd be the same for semaglutide. But also, even if they lost that, and like let's say they were granted by the FDA the ability to make a generic semaglutide now, it would be
in shortage.
A couple of years probably before we'd see it, and then another 6 months to 12 months after that before you'd see the generic actually driving down the cost.
Okay. Do you think that's why Novo's not pushing like Eli, though, because they're already getting challenged and it's not worth their time? Or?
You know, my honest opinion about that, and this is just, I mean, all of this is opinion because, again, I'm not an expert in any of this. After listening to all the earnings calls that I've listened to, it really seems like Novo Nordisk is a more patient-focused, patient experience matters company. And you might be like, well, why? Right? Well, first of all, the shark-like nature that Eli Lilly has gone after the compounds in the United States, and the fact that Novo hasn't, is one indication. Now, the people in Australia would take umbrage of that because Novo Nordisk got compounds banned in the entire country.
Oh, wow. Yeah. Oh, yeah.
That was all Novo Nordisk's effort. But there was some crazy stuff going on in Australia. Do a Google search for the Ozempic cowboy. And then you'll get a whole education on Australia. So with Novo Nordisk earnings calls, they spend a ton of time talking about the importance of the patient experience. They talk about the importance of their employees' experience. They do all sorts of really innovative stuff to make sure that the people who are making semaglutide are not getting overworked because it's unprecedented demand for that. And so, like, they're doing all these surveys and changing employee benefits to, just make it so that their employees aren't getting burnt out. You don't want somebody asleep at the switch when pharmaceutical medications are being mixed. And so, like, these are things that Eli Lilly never talks about. But Novo Nordisk does, and it seems like they just have more maybe of an intrinsic people-focused company. That's just my gut reaction based upon my own experience. The other thing that I think plays into this to some extent also is Eli Lilly has a lot more to lose here, I think, because CagriSema is coming around the corner for Novo Nordisk next year. And it's going to be so much better than semaglutide alone is, that I think that Novo's made the calculation that they're going to sell everything that they can make. And I think really I just think they want to sort of stay out of the compound thing and just not have it be their business. Because I think that if they can sell everything that they can make, and you kind of couple that with what they say in their earnings calls about the fact that their stated goal is to bring medication to as many patients as possible for as cheap as possible. And you heard that from their CEO last week on Capitol Hill. He's like, listen, you guys are kind of playing games with the PBMs and the system and all that. He's like, but if y'all want to sit down and really talk about how we make medicines cheaper for people in the United States, we're ready to have that conversation. Because they kept trying to say, will you lower your price? Will you lower your price? Will you lower your price? And he's like, the problem is we can lower our list price, but in the United States, that doesn't mean that patients are going to pay less money. It typically means that Novo will make less money, the PBMs make the same or take the difference, and then you and I end up paying the same. And so, like, I genuinely just think they care more. I don't know, like, I guess that's pretty blunt thing to say, but I guess how I feel about it. I just feel like Novo Nordisk cares about people more intrinsically as a company. Not saying that people at Eli Lilly are heartless or don't care about people, but I just think it's more baked into the culture maybe at Novo Nordisk based upon my studies of the two companies.
Right on.
Yeah. Wild stuff. What a wild couple of months, really. And don't you think, Kelly, that don't you think that when Eli Lilly decided to take tirzepatide off the shortage list, like, I'll put it this way, when they decided they were going to stop saying it was in shortage, that was pretty close to the time that the Chevron thing passed, wasn't it?
I think so. Yeah, it was all
I think they were watching that case and to see how it unfolded. And I think that they already had a game plan. If the Supreme Court comes down our way, in air quotes, on this, then the FDA cannot continue to it doesn't really matter what we say. They're not going to fight us on this. Yeah.
Well, and we all knew that was the thing. So, they knew. I mean, they're not, they got lots of smart people, working for them. They knew. I agree. I think that's, yeah. Yep.
Because it definitely was. It would just definitely seem to me like it was a matter of we're just not going to say it's in shortage anymore. And people are over here going, I haven't been able to get an update on when it'll be available in my area for a month. It's like, it's just crazy. And then they pass along this thing. Well, the distributors supply the pharmacies and cold chain and blah 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 blah. And it's like that. That doesn't pass the smell test when people from Lilly Direct can't get their medicine.
Yeah, no, I see it when I logged into the drug shortage. It was on I'm like, come on, every single one.
Wild.
Now, with indications, obviously, the more and more that come out, the better chance, I guess, you may have to get it covered by insurance. If there's nothing else that works for that, that thing, or I don't know enough. I know for weight loss, they're all skeptical because they think you're going to put it back on and all of this, but
yeah, I mean, you're kind of getting into insurance adoption.
Yeah.
I think in order for Eli Lilly and Novo Nordisk to get what they want to get out of these medications, I think they both have to make plays to go direct to the consumer.
Okay.
Because I don't.
You mean bypass the insurance?
Yeah.
They're not doing it that much cheaper right now.
I think that, like, again, you have to look at the net price. Like, so Eli Lilly's list price is $1,100. That's not how much they make on selling the drug. They make around $400 or $500. And so when they go, okay, $400 or $500, and this is all baked in by the money scientists, right? They go, this is how much we need to make. If they just offered a direct $400 medication or $500 medication to patients and just went around the PBMs completely, it completely cuts them out. And I think that, like, I think that's what the sneaky, clever thing about Lilly Direct and the vials are, because it is a play that allows a pharmaceutical company to go direct to the consumer in a way. And so I think what they've calculated is we're not going to get legislation in this country that gets rid of the PBMs. Everybody wants to do it, but nobody wants to do it because those companies have way too much power and influence over our government. They're installing their candidates by virtue of propping them up financially. So when they get in there, there's just not likely to see it happen. And I think that the pharmaceutical companies have seen the writing on the wall. So when they come up with a novel treatment, what they have to determine is how much do we consider ourselves, how much do we consider PBMs our clients, and how much do we consider patients our clients? And if you read the Fortune article that was on Eli Lilly, the one that they had a blurb in there about on the pen, the whole thing is like Eli Lilly needs to start considering itself a direct-to-consumer brand. We need to market that way. We need to communicate that way. Now, they have a long way to go if that's who they want to become. But this is the way that they need to start thinking. And I think like that Lilly Direct could have been an open door to testing the waters on what it might look like if they went just circumvent the whole system, at least with this class of medications. Because I think there's enough people, whether people like it or everybody wants cheap drugs, everybody wants free drugs, but that's fantasy land. That's not reality. This stuff takes, to create a safe drug and bring it to market, takes billions of dollars. 1 out of every 8 medications that Big Pharma puts in clinical trials makes it to market. So you're not just paying for tirzepatide and the development of tirzepatide, you're paying for the other 7 that never made it to market too. And also trying to make them meet the demands of their investor. So it's not realistic to expect that this thing's going to be available for $100.
Yeah.
But I think like enough of us have paid enough money all over our whole lifetime to try to fight back against obesity that if somebody were to 10 years ago go, you know what, I can give you a 90% chance that you're going to lose 25% of your body weight in a 2-year period, and it's going to cost you $20,000. Like, how many of us haven't spent $20,000, $30,000, $40,000 cumulatively over our lifetime on diet food, on diet pills, on diet programs, on pyramid scheme bullcrap? None of it, which works because none of it addresses the biological need, right? But this does. And so it's worth, you know, the cost of admission to get the medication. And I realize that that's not, again, that's just living in reality because there's so many people that are left out of that equation because they can't afford it. And that's a health equity thing, not anything that you or I are going to solve in this conversation. But, you know, all of this is extremely, extremely complicated, and people want easy answers to it. And there are no easy answers to it. That's just the reality. But you know, what we can do to kind of bring it back full circle, what we can do is we can be as informed as we can be so that we know what our next move is. And if this happens, this is what I'm going to do. If this happens, this is what I'm going to do. And that's why people should be following people like Kelly. And it seems like many, many, many people have gotten that hit. 31.5K. I mean, you have just blown up. That's amazing.
Right back at you, buddy.
550 people in this live.
I know. Follow him if you're not. And of course, follow me if you're not. I mean, come on.
Of course. Yeah. Well, it goes both ways.
And he's on YouTube, big time. We're going to interview next week. That'll be a different thing. But thanks for rescheduling. It was just too crazy, and I'm burnt out, and I didn't want it to be all like,
Yeah, like, and that's how I felt for the last 2 weeks. Like every video, I'm like, I don't even want to do this. But
it's a lot.
But you just like that. You got to fight through it, right?
Yep.
Yep. It's hard when you devote a good bit of your life to just bringing information to people, and then just like nothing's ever good enough. And it's like, dude, what do you want me to do? It's not like I created this system.
Yeah.
It's not like I made. That's my favorite thing. Is like my favorite comments over the last week is like, "You did this. Release the Vials did this." I'm like, what a dumb,
I saw that.
thing
I'm like,
to say. Just go away. Go away. What
Yeah.
like the reason they released the Vials is because there was more money to be made.
Yeah.
They could sell more stuff, and that's exactly what they said in their earnings call. We're going to have more sellable doses, so guess what? We're increasing our profitability by $2 billion. We're increasing our outlook. Why? Oh, because we figured out how we can release some of these vials. We're tapping into our extra manufacturing, and we're going to be able to make this many more. Guess what? They could make a million more vials a month. They'd still be in shortage because there's that many people starting this drug. It's crazy.
Yep. So for those that don't, because people have been asking, if you go to onthepen.com, you will find everything where you can follow him and everything. Onthepen.com.
Yeah, all the things.
All the things.
All the things. Thank you for that plug, by the way.
Oh, well, of course. Come on.
I think the vials are probably sold out. I mean, I don't think that there's anything. I don't think there's anything sitting anywhere going, sell me. Here's my hope. And I did a video on this earlier today. My hope is that Eli Lilly releases all the vials, and I hope that they keep them at that $599 price. I don't think that's asking too much, right? Or low. I mean, ideally,
a little bit lower.
Ideally, it'd be lower. But if they already priced the 5 milligram at $599, they're not going to go, oh, we're going to release the 7.5 and drop it to $399.
Yeah.
I think if it's at that $599 price range, which is what people with the savings card pay that don't have coverage, I honestly think like that is a reasonable thing to expect Eli Lilly to do. I realize like that's too expensive. I get it. But the reality is they're not going to give this thing away. They're just not. They won't. They can't. That's the more important thing. They can't because their investors would revolt, pull their money out, and then there'd be no Eli Lilly.
No retatrutide, and no
retatrutide, and no whatever the next thing that's coming on. Because guess what? Tirzepatide don't work for everybody, and so there are those of us who are really holding out for the pipeline of drugs that are still to come. And so I just think, we want to get this medicine and we want it cheap. Do we want them to release it for $250 and just let everybody get access to it? Yeah, but if they released it for $250, which is cheaper than the compound, there'd still be people going, well, I can't afford that, or my neighbor can't afford that. Like unless you give it away, you're not including everybody. And then there's no Eli Lilly because that's fantasy land. Things don't appear out of nowhere for free. So there's just no easy answers here. But I guess some people are poor, Dave. Sorry to say. I realize that. And that sucks. It sucks that there are people that are left out of the equation. But what do you propose? What do you propose?
Well, there's states now that are, even North Carolina, they thought they were going to go bankrupt and they worked it out, and now they're going to be offering, Wegovy for Medicaid. So I mean, but only 16 or 20 states right now,
right?
Do it,
Yeah, not that many.
Not enough, but it's not that simple either because they're friggin' expensive.
Right.
Someone still pays for them. You know what I mean? The state, your tax money, someone is still paying for them.
Right. One of the things that I thought was really interesting that you heard out of the Senate committee hearings last week was that they were saying to the CEO of Novo Nordisk, they were saying, here's the deal. Why can't you just offer it at a list price that's what everybody else pays in the rest of the world? And he's like, well, because in the rest of the world, you have the government negotiating the cost of the medication and they pass the savings on to their people. In the United States, you have PBMs negotiating the price of the medication, and they want expensive drugs because they want to take 74% of it and line their own pockets with it. And the senator brought up a really great point. I don't remember who it was, either Tim Kaine or Mitt Romney or one of those guys. He's like, but you can't tell me that if you go back to those countries and you say, sorry, we're just not going to sell it here for that price. Their people would revolt because your medications are life-changing, and your people would rather have it at $500 a month than $200 a month, or they'd rather have it for an increased cost than to not have it at all.
Yeah,
to not have it at all.
They could level it out a little bit.
Yeah, and so I mean that's one of the things that I think that the pharmaceutical companies could do a better job of is just towing the line and saying, no, if you want your people to have these medications, then they're going to pay what the United States pays. The problem is then that country revolts. And then that country's like the evil pharmaceutical company. But all we want here in this country is for the cost of these medications to be spread out among the rest of the world. The United States is not rich enough anymore to carry the back of the rest of the world, which is developed and wealthy and all those things that it wasn't 50 years ago, 60 years ago. We just can no longer do that, especially with the cost of everything else. I mean, food is, I have 4 kids. We don't leave the grocery store without spending $400. And everything that you buy there's been shrinkflation. So the stuff that used to last you a week is lasting you 3 or 4 days now. And you're paying 25, 30% more than you were a year ago. It's not financially sustainable anymore for the United States to foot the bill for the development of the drugs that serve the rest of the world. It's just not. And that's where I think we can actually hold the pharmaceutical companies' feet to the fire a little bit more to say, you guys need to have a stronger backbone when you're arbitrating with these single payer countries, because you should be able to spread that cost out.
Yeah.
And you should, in the United States, we should have some legislation here where our government can negotiate on behalf of the people so that we're not carrying the burdens of the rest of the world. We're not rich enough to do it anymore. That would be my main plea is like, we can't afford it.
Yeah. Yeah. Right on. This has been great. Do you mind at some point, I want to take this portion of my live and maybe put it on YouTube or something. Are you good with that?
Yeah.
I think it's been so good.
Yeah. This whole conversation is good to have because its fingers go into everything about accessibility. It goes into the cost of the medication. It goes into the accessibility, the availability of the medication. It goes into patents. It goes into politics. It goes into all these things that are frankly just very, very complicated. And the thing that I keep having to remind people of is just there are no easy answers. It's not as easy as Eli Lilly needs to lower the cost. Novo Nordisk needs to lower the cost. Yeah, that'd be great if it actually meant your drugs would be cheaper. But in the United States, that's not how it works out. And as the CEO of Novo pointed out also, he's like, when the government forced down the cost of insulin, basically what happened is formularies started dropping it. Why? Because they want the expensive insulin on their formulary. Why? Because they take 74% of it. So all of a sudden, all of our patients who were on your insulin product that was maybe $300 or $400 list price, now it's $25. The PBM's not making any money, so they drop it from the formulary in favor of a more expensive one that they can make money off. So when they lower the price, maybe they lower the price, maybe it becomes cheaper for some, but then it gets dropped off of formularies.
That's disgusting.
And you have no access, and now you're forced to pay the list price. So it's just so complicated, and there are just no easy answers. But I hope that Eli Lilly releases all the vials. I hope that they I hope that they release the vials, and I hope they release them cheap. But knowing that that's not going to be reality, I hope at least they release all the vials, and at least they don't raise the price above what they're currently offering the 5 milligram at. I think that's a reasonable request. You know, if we're being like asked for what we want versus what we think could happen, then yeah, release them all, make them as cheap as compounds were. But that's just, I don't see a world where that happens for about a million reasons. But I don't see a reason why they couldn't release the vials, the upper vials, and just leave them at $5.49 for all of them.
Yeah.
Maybe you'll see them go to $6.49 for the upper doses, because that's where the savings card is now. Mm-hmm. I don't know, but which is still a huge chunk of change. I mean, I'm not denying that, but if they did that, at least it's something. Where right now you've got a bunch of people, 1 million people that are losing access to tirzepatide, that, you know, their only choice is to go to a different drug, which is for not everybody. For some people it'll be great, it'll be fine, and people be like, whoa, I wish I would have known about this cheaper option all along. This works just as good, or it works better. For some people it won't work. For some people they'll have more side effects. For some people, you know, it's not going to work for everybody. And so what do those people do? I hope to see Lilly throw them a lifeline in some way.
Agreed.
We'll see, right?
Yep. Hurry up.
My goodness. I called somebody on the way home. I had conferences for all 4 of my kids before this, and I called somebody on the phone, and I was like, boo, was just rattling off a bunch of this stuff the same way. I was like, I've had so much on my mind all day that I haven't been able to like get out, so I appreciate you.
I hope this helped in some way. You know, you're outside too, so that's always good.
Yeah, a little vitamin D.
Yep.
Always helps. Well, good catching up with you. Thank you for inviting me on, and we'll catch up next week and do another one and put it on YouTube.
Let me know. I think Tuesday suggested, but you just let me know. I'm pretty easy.
Yeah, okay. Sounds good.
All right. Cool.
All right. Thanks, Kelly. Have a good day. Have a good day, everybody.